Well, greetings again. This is Dr. Bill Wyatt, and we're starting out another year here. And I want to cover some cases that we did really early. This particular case we're talking about, we started in 1971. And we have some pictures of this lady in 1993, I think, something like 22 years later, to show you how this held up and everything during this period of time. And we see this has multiple problem cases, but actually she was missing her upper laterals, and then we've got an impacted cuspid. It was in terrible shape. It reached across from the lower cuspid over to the lateral on the other side of the mouth, and we had to pull that up back in that time. And we had to shape her cuspids into lateral teeth, and just a whole host of problems here. And what we're trying to bring out is that doing orthodontics, I mean, you make the facial structure look better. You just make life better, really, all the way around. If your teeth are nice and straight and your facial structure looks good, it makes a tremendous difference in your life. So we're going to have that as our purpose for doing orthodontics this year, and we'll talk about it. So let's get started on this young lady, and we'll it's a pretty complicated case. Now, she started out, I think, in her 11 or 12 or somewhere in that area, and she's missing her upper lateral teeth. And we'll go through, we've got all kind of stuff on her. She was 11 years old, and this was in 1971, and when we started, and they had a kind of a closed bite there, not a great deal of closed bite. And here it is in 93. So this is the x-ray from when 20 some odd years later. Here is the way her teeth fit together later on down the line, about 22 years after we started. All right, when we pulled up the video, we took this Panorex x-ray back in 9 of 7, she was age 11, and this was 9 of 71, and this impacted tooth on the lower right is really a doozy. I mean, it goes over, and actually it almost touches the tooth on the other side of the mouth right here. And this is going to be a tough deal to get out. These teeth are impacted too up here, and these are cuspids coming in, so we're going to have follicular movement of the teeth. All sorts of things go on in this particular deal. Now, these are deciduous laterals right here, or cuspids. We're going to get them out. Then we take these cuspids and move them down, and we'll shape them up like lateral teeth. We're missing teeth up here, so we come down and sacrifice some teeth on the bottom arch to match up, to make it work out. We had no wisdom teeth in the case. And so here she is, 11 years old, and this is it's a real late 12-year molar, or else it's a wisdom tooth. One of the other was gone. So she's missing her laterals and 4 wisdom teeth, or 4 12-year molars, and we're going to sacrifice the other 2. Now let's get on with this. Now this is what we found out. This is that cuspid tooth. It's way down in here, and the crown of that tooth touches this lateral on the other, well, actually it's the central on the other side of the mouth. Now we've bonded a hook on this thing. We went in surgically and bonded this hook, and it comes up here, and we're going to hook it. And this was back before we had the springs and all the good things that we use in impacted teeth. So we were using elastic thread and something like that. So here this tooth is now. This is 5/8 of 72, and this tooth has gone from way down here, touching over here. We've got it straightened up here. We're pulling it up. Let's go back and look at it for a minute and look at where it moved to during that period of time. So we kept working on that, pulling it down. The follicle around these teeth, where we took these baby teeth out, these will start heading down in the place there. Now this is in 1973, and this is a drawn-out case. It takes a long time to do. Now as these permanent teeth come down, look at this follicle developing around this cuspid tooth up here on both sides, and those teeth are headed down in the mouth good and look like they'll come on in. Now we'll shape them up like laterals. Now this is 74, and one of them looks like it got hung up in here, running in, and the other one is coming on down good. So we have to come in and compensate for that. Now here it is in 1976. We've got the cuspids down in place, put them in, and this was back when we had to band everything. We didn't have brackets, and we didn't have a good bonding material to get the brackets in there, everything. But here the teeth are lined up in there, that impacted cuspid that was running way over here. We've got it up in this area right here now, and we've sacrificed a bicuspid to the first bite to get it back into there. Now we've shaped these up into laterals and then banded those shaped laterals up like that. And now this is 1993, 22 years after we started the case, and here these teeth are in this position. Now I'm going to go, and I think this is the last picture we've got on this, but she's in a good class 1 relationship. The overbite and overjet is everything, and this center line is looking good. So I'm going to go through the models. This is the models that she came in with in 1971. And these teeth are worn down there in the front. I'm going to run through this real quick. We used elastic thread to hook on to similar, and we developed this method of bringing these in with springs later on, which is much more efficient way to do that, but this worked out too. So we pull that tooth up over that hook in there, and that tooth was over here touching the lateral on the other side of the mouth, and it's coming up, and we'll pull it up in place, and you'll see it come in here in just a minute. So the tooth is headed up, and the thing is, you leave these teeth free to float, and they'll move in and let you drag this tooth over those teeth, and then the roots will come back and center up in the bone structure of the lower jaw there. So we're coming in. Now we also did a hemisection of the deciduous second molars, where you go in and do the pulpotomy on these teeth, and we're trying to get the other teeth room to develop down in here as we bring this cuspid in, pull it over on that side. And now the tooth is coming up to that point. This is 1972, and during this time, back when you had bands and brackets like this, she bit one of these brackets down and mashed it, and it pushed it down on the wire, and the wire pushed the tooth up. So we had to run into that problem right there. But we took that band off and put a new band with a bracket on it, and this was these big brackets we had back in that day. And we go in here. Now we're getting the upper teeth to come in, the upper lateral cuspids, and we're going to shape them up like laterals and put them in place in that fashion. Now we've opened that gap with a spring, and it's coming in good. Now we've got this one cuspid coming down good. This other one stuck up there, and we had to go after it. So this is another thing that you need to learn how to do. We take electrosurge and just cut around this tooth. We knew where it was by the way we looked at the x-rays, and we cauterized this, then we dried this out good and etched it, and we bonded a hook on this, and we'll come in and hook that tooth and pull it up to this area by coming in with the elastic thread like that. And when you take the tissue off, stay away from the side of the tooth. You want this will heal back up and fill up, which you'll see later on. Now we pulled on there with elastic thread, or we can pull this. Now this one was over here. We were coming in with elastic thread to get this cuspid up here that we just had the hole where we bonded to it, and it's sliding down in place. Let me go back here now. Now it's coming in position. Now this tooth came in, and it needed to be rotated in this direction. So we bonded. Now this is the bottom is in now. This is that tooth that was over here. Let me show. I'll go back to the top. Now we went in and bonded a wire onto that particular rotated tooth. I just bonded it on here with what we had and left a hook here, and we pulled it in that direction, and that'll rotate that tooth. Now we go in and put that chain around it. Excuse me. We go in and put the chain around them and do it a little more efficiently that way. All right, this is 1975. You can't go in on these cases and do them in a year or two. It takes several years because the teeth are erupting into the mouth, and you can't do something with them when they're when they're still coming in the mouth. And this is just a hook we had on the bonded that hook on there and pull that tooth around. And here the cuspids now have been shaped into laterals, and we put bands around them. Now we would just shape them that way and put a bracket on them. And so you can see how they work out there. And this is in 1976. So we've been on this case now from 71 to 76, and that's getting close to 5 years. But there's no way that you can do this case in a very quick fashion. Now here's the facial structure after we pulled it in their place, and there the case is. I think this is 76 when we pretty well finished the young lady out. Now these cuspids don't look too much like laterals, but we got better at that as we went along. And this is the tooth that was down and touching over here, and we pulled it across these teeth back years ago. We did these things, and that's what we're trying to show today, how people can do these. And we think that a pediatric dentist should be equipped to come in and do these cases on pediatric patients like this. So here it is in 1993, and this is the way the lady's teeth are after about 22 years from when we started the case. Now the teeth are fitting in together good at this point. And here is the pictures that we had of her when she was just a young girl there in 1971. And this is over to the right is 1973. She's a school teacher now. And this made a total difference in the way this lady life would be. And that's what we're going to try to bring out this year. Orthodontics changes your life to a better way of living. It just helps out that. So this is the way. She's awful serious looking in these two cases, but here she is smiling. So this is where we're going to end. Thank you for watching, and you can do some fantastic things with people. We've been doing things this complicated back years ago. There'll be people out here looking at this that won't even be born when we were doing this. And we're trying to get it across still. People just are reluctant to go in and pull some tooth across like that. Thank you for watching, and I'm going to close up here. My voice is about to run out on me, but thanks again for watching, and I'm going to close out here and say join our group and subscribe to our channel. Thank you very much, and we're going to go